Okay, welcome everybody. Thank you to everyone for joining today's Network Mind Out webinar with Damien Riggs. Before we start, I'd just like to acknowledge the traditional owners on the land on which we have gathered here today. And certainly when we facilitate webinars, we recognise that we are meeting across all of Australia, so come from lots of different countries and lands across Australia. So to recognise the traditional owners of all of these lands and to pay our respect to their elders, past and present, and to emerging community leaders. Today we have Damien Riggs, who is going to be presenting a webinar on a critical development approach to working with transgender and non-binary young people. So Damien is an associate professor in social work at Flinders University, an Australian Council research fellow, and a psychotherapist in private practice who specialises working with trans young people. So today's webinar really intends to provide you all with an overview of the mental health needs of transgender and non-binary young people. And we'll be outlining an approach to working with trans and non-binary young people that is mindful of both their diverse needs and also of their parents. So I'm quite excited about having this webinar, and I certainly have found historically when we have webinars on working with trans folk that people are really quite engaged, and I believe this is because often we don't have access to much knowledge and professional development around transgender people. So thank you everyone for joining us here today. Damien's happy to take questions throughout today's webinar, and you can ask Damien a question through typing a message in the chat box. So if there's something that Damien is speaking about that raises a query or a question, please just type a message in the chat box and Damien will see that. If it's something that he's going to talk about later in the webinar, he'll touch on that. And again, there'll be time at the end of today's webinar to unpack some more questions. And actually, just before we start, before I hand over completely to Damien, I actually just want to double check that people can see and hear us okay. So if people can just write a little message in the chat box to say, thumbs up that you can hear us, that would be wonderful to know that actually, people can actually see and hear us. Yep, thank you, Claire, all good. Thanks, Jane, thanks, Ricky, excellent, wonderful. Sounds like our sound and video is looking good, Damien. So I'm going to hand over to Damien now to present today's webinar, which is fabulous. And I'll come back on again at the end of the webinar just to facilitate questions. So thank you very much, Damien.
Thanks, Ellie. Thanks for such a lovely introduction. Hi, everyone. Thanks for taking time out of your busy day to join us today. As Sally said, if you have questions as we go along, just put them in the chat box and I'll try to get to them rather than having a big lump of questions at the end. So as Sally said, I am going to do a number of things. I'm going to outline Garvey-Ansara's Cisgenderism Framework and use that to think about how cisgenderism impacts on mental health of trans and non-binary young people and how it shapes. So that's sort of a bit of a backdrop. And then I'm going to move on to think about gender development. I'm going to talk about the existing models that we have that are quite problematic for everyone, I think, but specifically for trans and non-binary young people. And then I'm going to outline a different approach to thinking about gender development that I've been developing. And then I'm going to quickly just go through a case formulation approach that I use. I'm not going to go through a specific case, but just look at how I use that case formulation to do some of the work that I do clinically with trans and non-binary young people. So you might know the work of Garvey-Ansara. He's published a lot outlining his cisgenderism framework, and he and his colleagues define cisgenderism as an ideology that delegitimises people's own understandings of their bodies and genders. So what does that mean? An ideology in terms of cisgenderism presumes there's only two genders, female and male, and that they're binary. The gender is immutable and it's based on assigned sex. So we know that those kind of assumptions are really problematic for trans and non-binary people. And the use of, I think, for cisgenderism for me is to help us to identify when cisgenderism is happening. So Garvey identifies a number of different forms of cisgenderism. So misgendering is a very obvious one. You use the wrong pronouns for someone. Silencing is when we might acknowledge that someone is trans but say, I don't want to talk about it. So a family member might say, I hear what you're saying, but I don't want you to speak about this. Don't tell your grandparents, don't tell other people, it should be secret. Pathologizing is when people say that being trans or non-binary is a mental illness or it's a sin. And binarizing is when people only acknowledge, even for trans people, that there are only two genders and there's no acknowledgement of non-binary people or gender fluid people or gender queer or agender people. Obviously, cisgenderism is something we want to avoid in our work with young trans and non-binary people. For me, the key to doing this is to always start and end with a young person's description of their gender. We don't need to ask, how do you know that is your gender? How do you prove that is your gender? We work with what the young person tells us. And a good way to make sure we don't slip into cisgenderism is to not try and think in our head, okay, so you're telling me that you're a transgender girl, therefore you must have been assigned something at birth. That kind of thinking, that kind of constantly trying to make a link between assigned sex and gender is a really one way that will make you slip up and use the wrong pronoun. So it's good to not have that in your head, not even to work with that idea, certainly not to work with that idea about assigned sex in the clinical space. So cisgenderism is important to understand because it shapes all of our lives. It's an ideology, so it's all around us. But specifically when we're thinking about young people, it is one of the key reasons I would argue, and certainly Garvey has argued, why trans and non-binary young people come to mental health services. I'll talk about that why on the next slide, but I want to acknowledge here that this is not to say that some young trans and non-binary people will experience poor mental health and that would occur absent of cisgenderism. And it's also not acknowledging that some people might not really benefit from being able to talk through their gender and unpack where they're at with their gender. So it's not saying that every reason that a trans or non-binary young person comes to see us is because of cisgenderism, but it's about acknowledging that a lot of it is about cisgenderism. So what is it about cisgenderism that leads trans and non-binary people to services? Part of the answer is about gatekeeping, about people wanting to access, for example, puberty blockers or perhaps hormones, perhaps later on surgery, is that at the moment in Australia this requires some form of assessment and report from a mental health professional. So that is cisgenderism in itself, saying, you know, we need to assess you to determine whether we believe something about your gender that would authorise some sort of treatment. And that's part of a long history of gatekeeping services to trans and non-binary people. Cisgenderism is also a cause of poor mental health. So when you live in a world that is cisgenderist, where there is discrimination, where you're getting messages that are pathologizing, that can negatively impact upon your mental health. And finally, it is, and a bit different to the first point about gatekeeping, it's about the idea that those of us working in the mental health professions are seen as having some kind of authority. And often people, and this is especially parents, often think that if I can just get a clinician, and I hear this a lot, to say, yes, my child has gender dysphoria, yes, they have this or the other, then, oh, I can be more comfortable in being accepting. So that's another way in which cisgenderism plays into trans and non-binary young people coming to see us, is their parents often wanting some sort of authorization to be accepting. So what do we know? We know a lot from the data, from the research evidence. We know that trans young people who are not supported, who are rejected by their parents, who are discriminated against school in a context of cisgenderism, experience much poorer mental health outcomes than trans and non-binary people who are supported by their families in school. And some of the most recent research has found that trans children in particular, who are supported by their parents and families, have mental health outcomes on par with their cisgender, which is a word for non-transgender, with their cisgender peers. So it's really important to acknowledge that cisgenderism has a very key role to play in the mental health outcomes of trans and non-binary young people. Both the recent Trans Pathways report and the previous Blues to Rainbows report both acknowledge that a percentage, and for the Booster Rainbows report, it was a higher percentage of young people reported that they encountered challenges in working with clinicians. And a lot of this was about misgendering. It was about clinicians not taking them seriously. It was about clinicians stigmatising trans and non-binary young people. So this shows to me that we still have a long way to go, and that's why we do this kind of webinar, to help people work through their own barriers as clinicians to providing affirming care. Another way, and I think to me, in my recent work, and I've been working on a book on this topic that forms the basis of today's webinar, cisgenderism is something that really plays out when we talk about gender development. So there was some research that first was conducted in the early 90s looking at trans young people, and it said that transgender young people do experience what was termed a developmental lag in understanding gender constancy. And what do they mean by that? Well, these trans young people were saying, I'm this gender or I'm that gender, and there was only boys or girls included in this sample. But the researchers said, well, because you're talking about this gender, but you're not talking about your assigned sex, we're going to say that you don't have a proper understanding of gender. What they were looking for was the child to affirm, this is my assigned sex, and therefore, in a context of cisgenderism, this really is my gender. But of course, the young people weren't saying that. They were speaking about their own genders because they were trans. And so it's really important to acknowledge that that piece of research and other pieces of research that followed on from it really have shaped how we understand gender development for trans and non-binary young people. So there's a number of different approaches to understanding gender development for children. One is a Socio Cognitive, and it says that if you understand what I was just talking about on the previous slide, that will shape your behaviour. So for a child under the Socio Cognitive approach, they're to be able to correctly categorise their own gender, but what they really mean is categorise their assigned sex, determine from that a normative gender. And that had to happen around the ages of 2 to 3 years. Then around by the age of 5 years, children are supposed to understand that gender that they've identified, but actually, again, the literature is really talking about assigned sex, is constant and won't change. And then shortly after that, children are meant to be able to understand that if I cut my hair off, if I wear different clothing, that will change my gender. We know that this is a really problematic way of thinking about gender. Firstly, as I've said a number of times, it conflates or collapses assigned sex and gender. So a good example is, for a child who is male, their gender is male, but they are assigned female. Under this socio-cognitive approach, a young child will be seen as not having gender constancy, of not actually understanding gender as a category. So this really is a problem because it is about not acknowledging what trans young people are saying about their gender. It's about saying their understanding of gender should reflect a cisgenderist account. And that's really important to be mindful, I think, when we're thinking about these developmental approaches. Another common approach to understanding gender development is social learning. So this sort of says the opposite of socio-cognitive. So socio-cognitive said you know the rules of gender, then you can understand your gender and behave in particular gender ways. Social learning says that you see how other people model what it means to be a particular gender for you, and then you will come to be that gender. So if a parent keeps saying, oh, good boy or good girl, the child will say, oh, okay, then I'm a boy. So again, this is a really problematic way of thinking about gender because, for example, a young trans girl whose parents are not affirming, the parents might keep saying good boy, that's not going to change that she is asserting herself as female. So this idea of modelling and reinforcement doesn't really apply to lots of children, including trans and non-binary children. And Sandra Bem argued also that it really sees children as very passive recipients of the world around. It doesn't acknowledge that children are active agents, actively interpreting the world and making sense of gender on their own terms. So there's a number of different ways in the social learning literature that says that parents play a key role for modelling and reinforcing children's gender. All of this research is on cisgender children, but I think there are specific implications for trans and non-binary children. So one form of modelling that parents are thought to do is shaping or channeling children's gendered behaviour, so buying trucks for children that are male and buying dolls for girls that parents think are female. And we know that for some parents of transgender children, some parents might make some sort of what are in the literature term concessions, but they'll also really regulate children's game playing and might have what is called an at-home rule. So you're a trans girl, I buy you a dress, but you can only wear that at home. You can't wear that out in public, or you can't take the Barbies I've bought you out in public. So there is some recognition in those sort of examples of a child's gender, but there's still a lot of shaping and modelling going on. There's also the idea that parents model gender around differential treatment. So, for example, saying that boys shouldn't cry, whereas girls should be emotional, good girls should want to be maternal. So again, this is shaping children's behaviour. There's then direct instruction, so saying you can't do that. Boys can't wear dresses. Boys can't play with dolls. And the final one is role modelling. So if you have parents who are heterosexual and the father takes a very particular gendered role, perhaps paid work, and the mother takes a particular normatively gendered role, perhaps being at home with the children, this models to children what a particular gender is meant to do. Again, these are really problematic for everyone. I think they're problematic for all children, but they're particularly problematic for trans and non-binary children because it's based again on this idea of assigned sex determining gender, which is cisgenderism, and it's also based on not listening to what the child is saying about their gender, but rather trying to model and shape a particular gender that's associated with assigned sex. So the third approach to thinking about gender development is gender schema theory, and this was developed by Sandra Bem. At first glance, it seems really positive, much more positive than socio cognitive or social learning. It's positive in that it, again, is looking at gender as an ideology. It's looking at how do stereotypes and social norms about particular genders shape how we understand people's gendered experiences. And Sandra Bem was coming from a feminist standpoint, so she was really trying to challenge gender norms that limit how women and men can live their lives. And she was mainly looking at women and men in gender schema theory. The problem is, though, again, Bem was resorting to ideas of assigned sex. So she writes a paper where she talks about how she was trying to engage in feminist parenting with her own children, and the message she gave them was, and I put this here as a quote, "Your genitalia determine who you are, but not what you can do." So she was trying to say, look, you know, you're born with a vagina. People think that women can't do this X, Y, and Z. No, you can do whatever you want. Of course, the problem is that she's collapsing gender and assigned sex, which again is a big problem for trans and non-binary young people. But more importantly, the literature really does suggest that cisgender children at a very young age do not see some inherent relationship between assigned sex and gender. I would think I often say this, most children should not be seeing other people without their clothes on. So children aren't making attributions about gender based on what would be under someone's clothes. They're making attributions based on other things. And that sort of leads into my approach to thinking about gender development, which is a bit different it was a lot different actually to socio cognitive or social learning or the gender schema approach. So mine sort of draws on the really early developmental literature, like early in the stages of development, and particularly looking at Anne Fausto-Stalling's work on the development of bodies in utero and beyond birth. And some of this literature has very clearly identified that in utero, children can discern between, or unborn children can discern between different sensory inputs. So they can hear louder sounds, quieter sounds, different types of sounds, different types of, if a parent was standing somewhere where there was a lot of vibrations, then a child could discern that within the womb. So even at that stage, there is some sort of grouping, and there's been some experimental research done on this, sort of trying to identify how babies in utero respond to different external inputs. And so the suggestion then is that children are already making some sort of groupings. Oh, that's a very loud noise, that's a quiet noise. Obviously they don't have language, so they're not saying it in the way I just said it, but there is a process of differentiation going on. When we think about gender, of course, this is not going to really start happening until a child is born. And then once a child is seeing and looking and observing the world, they're going to start seeing groupings of people. They're going to maybe see groups of people who have beards, groups of people who have higher voices or lower voices, groups of people who maybe play with them in a particular way and people play in another way. But really importantly, again, we're not talking about language here. The literature talks about all these sorts of things and said, see, children can discern the difference between men and women. Well, young children who aren't speaking don't think about these categories that they're seeing, different pitches of voice or different facial hair distributions in terms of gender. They're just groups. And it's very unlikely they're going to be two groups. It's very likely it's going to not be just people with beards and just people without beards. It wouldn't be that simplistic. It will be a multitude of categories that children are starting to develop once they're born to group the people that come into their lives into different groups. And around this same period, so we're talking before language acquisition here, so still in the first 18 months, 2 years of life, children are going to start having an understanding of which of these different boxes they're coming up with, that will be multiple and more than two, certainly not binary, will be about how they feel, that I've got this box and these people in my life fit into this box, and that's how I feel about myself. That really is what I feel some affinity for. So Anne Fausto-Sterling says, this is about affect. It's about how we feel. Gender is about what makes us feel at home, what makes us feel safe, what makes us feel familiar. But of course, children will have these categorizations they've got going on about other people. They'll be finding a way to locate themselves in one of the very diverse categories they have. And then language comes along. And in the English language, we have binary language of male and female. And so children then have to start thinking, okay, so I've got all these categories, not just two. How do I limit those categories? And then they're going to start getting messages from people. This is a boy, you're a girl, look at that man. So they're going to be getting lots of different bits of linguistic information that can help them shape the categories they've already got. Of course, this is a problem, because they will have had categories that will be multiple, that will be shades of grey. And they have to reduce these to two categories, binary categories of male and female. In most households, there are probably going to be households where people talk about multiple genders, but I think in the majority of households, it's safe to say parents are speaking to their children about two genders only. And what this means for children is, again, how parents are speaking to them about their own gender might be a conflict with how the child is experiencing themselves in an affective sense. How do they feel safe in regards to what category they've developed? So, and I guess to go back to what I said before as well, children aren't going to be shaping these categories on the basis of, seeing someone's genitalia. They're not going to be presuming there's some fact to these categories that they've developed and the categories they're putting other people and themselves in. It's about affinity. And so children are going to come up against this idea that there's only two categories and you're in one of them. And I'm telling you, as your parent, which category you're in. And for trans and non-binary young people, there then is this real discrepancy between, okay, there's all these categories I thought were out there. I thought I was in one of them. Now you've told me there's only two, and you've told me I'm not in the category I thought I was in. So to me, this is probably a very long-winded way of saying that, contradictory to the literature that really has said for a long time, trans and non-binary young people, particularly at these very young ages, cannot know their gender. We should not be supporting them in their gender because they don't understand gender. My argument is very young children really do understand gender. They certainly understand categorisation, absolutely. They then, through language, come to understand gender, and in that process come to find themselves in amongst these gender categories. So I'm just keeping an eye on the chat box. I know that I'm moving through this a bit quicker than I had planned to because I thought there'd be more questions by now, but if anyone does have any questions, I would love for you to put them in the chat box or save them to the end, either is fine. I just want to make sure that everything that I'm sharing here, the stuff about cisgenderism may be very new, and a lot of information, and now I've just dashed through the normative developmental approaches to gender and my own approach. So I want to make sure that that information is sort of, sinking in for people, but you can always ask questions later, or certainly email me down the track for some more follow-up if you like. So now that we've had a chance to think about, okay, by my argument, very young children can know their gender. The youngest child I've worked with was very clear about her gender was 3, and increasingly the young people I'm working with are young, maybe around 6 or 7. These understandings of their gender are very deeply felt and experienced. And it is really about listening to young people's experiences of their gender, affirming young people's experiences of their gender, and acknowledging, just as we wouldn't be surprised that a young cisgender child has a very clear understanding of their gender, why would we would expect to be surprised that trans and non-binary people don't know their gender? There's, to me, really no logic to suggest there would be a difference in terms of which different groups understand their gender best or most correctly. So if there's no questions about that sort of theoretical background information, I might move on to talking about case formulation. So this was an idea that I've developed as part of writing this book. I guess when I look back, I've been doing all of those things in the last decade of my clinical practice with trans and non-binary young people, but it was a really good opportunity to just formulate this into a really coherent way of thinking about how to do case formulation when working with trans and non-binary young people. It's really important to express or emphasise that this is not linear. So I've got this lovely, neat gender mnemonic here that I just thought was neat. And I've done a lot of training this year and sort of shared this idea, and people have expressed it really has helped them remember it, having a mnemonic. But things happen in different orders. It doesn't have to be that you go from the first one, gender journey, and end up at R for reinforcement. It depends what comes in the room with you from the first appointment. You might start with distress, you might start with support. It really depends what's coming into the room. But my suggestion is at some point, if you're doing work over a period of time with young people, most, if not all, of these things will come up. So when we think about gender journey or gender understanding, again, we're not asking young trans or non-binary people to prove to us their gender. The young person comes to us and expresses their gender, we listen, we affirm that, we go on from there. But it can be useful to talk about what does your gender mean for you. I think that's useful for all children to think about what does it mean to be your gender. It's a good opportunity to unpack stereotypes. A young girl might think the only way she's allowed to be a girl is to be wearing pink dresses and sequins and Barbies, playing with Barbies, because that's the messages she sees in the world. That may not be comfortable for all children. We want to really give children as many ways of thinking about their gender as we can. So talking about gender journeys and understandings is really important. It's also really important to acknowledge that parents, if you see parents and children together, will bring with them their own thoughts about their child's gender. They'll have their own input. But we want to really be careful about how much of that we take on board, because parents might be trying to manage their child, trying to regulate their child's gender. So we want to really reflect that back to the young person and say, is this what it looks like for you? For parents, I find it really useful, particularly for parents who are really struggling, is to ask them, what is your gender journey? What is your gender understanding? Do you see gender as fixed? Do you see it as determined by assigned sex? How have you lived your gender? Has it changed over your life? How has other people's expectations about your gender limited your experiences in life? And often it's a really great way to get parents who are a bit stuck in affirming their child to think about, what would it have meant for me if someone said to me, no, you're not that gender. No, you can't act in this way as a woman. No, you can't act in that way as a man. It's a really good way to help parents shift their thinking. And it's also a useful way to identify sticking points. So parents might share, well, I try and adapt my thinking, but my parents are really rigid in their thinking about gender. So then it's a way to identify where some of the sticking points in the family might be. Moving on to the second letter in the mnemonic is express concerns. So there's some really common ones that we see when we work with young trans and non-binary people. It might be about feelings of dysphoria about their body. It might be fears about bullying. It might be worries about puberty starting. It might be about having started blockers but now really wanting to start hormones. It might be a generalised anxiety or anxiety that relates to gender. And it might be a general sense of being worried about fitting in. But there'll be some kids who have all of these, some who have none, some who have a couple. So it's again about listening. What are the concerns that the young person's expressing? Parents typically bring with them a lot of worries. How are my friends going to react? What's going to happen to my child at school? Will they be able to have a happy, fulfilling, intimate life? Will they ever have children if they want to? There's lots of worries that parents bring with them. And a lot of the time, unpacking that's really important. It can be they have misinformation. They may think, oh, I would really love to be a grandparent and I think my child would love to have children, but if you're trans or non-binary, you can't. So it can be just about something as simple as correcting that misperception. And it's really useful to open that space for parents to talk about their own concerns. And sometimes it's useful to do that without children present. Sometimes parents' concerns are a burden. So it's about really trying to gauge that and think about, when do we have those conversations? Are some of them useful to have with children in the room? Are some better to have with children not in the room? Someone's just asked a question about how do you work with parents on understanding language that's cisgenderist. I don't often use the word cisgenderism with parents, but I certainly describe exactly what I've described to you all today. How do these binary understandings, this idea that assigned sex determines gender, really impact upon our lives and impact upon trans and non-binary people and children specifically? And so often that unpacking of these concepts, just the other day a mum said to me, oh, I've grown up my whole life thinking gender is so black and white. It's so easy to put people in boxes. I've realised that actually it's not. There's a lot of grey when it comes to gender. And she could see that with regards to her own gender as well. So sometimes that really practical hands-on focus is a good way to help parents to work through their experiences or their concerns. So then if there are expressed concerns, or even if there's just something that needs to change, we get to the N of gender, which is necessary actions. I find this really important to do because, parents for different reasons might say they'll do one thing and then not do it or do another thing. And that could be because they're not being supportive. It could be because they're busy. It could be because they're forgetful. There's lots of reasons. But if we have a plan, an action plan, it's a really good way to help parents stay on focus for what they're trying to do. It's a good way for children to be able to see, okay, so we agreed on this. My parents haven't actioned this yet. I'm going to talk about this with Damien next time and see how I can help this to happen. It's a good way to help parents be accountable. I think too often parents aren't encouraged to be accountable to our children. So it's a good way to get parents to be accountable that these decisions we're making are really big decisions and the support you've offered to your child really needs to be implemented in a timely fashion. And it's also good that parents have often done a lot of Googling. This is a good way to condense what often is a lot of misinformation down to some really simple, agreed upon actions. If there is distress, and as I said before, not every child experiences distress, or some experience none, and then puberty approaches, and then they have blockers, and then they're waiting for hormones, which could be a number of years off. Distress can come about. So it's not that distress is always present or never present. It can come and go at different times in a child's journey in their life. So it's about acknowledging that even if distress isn't evident the first time you see a child, it could become evident later on. And as I've said a number of times, this can be about a child looking forward to something or worrying about something that's coming in the future. So we don't want to deny that, worrying about puberty, worrying about when can I start blockers is significant. It does connect to dysphoria for many young people. But we also want to encourage a focus on what are we doing now? How are we finding ways now to achieve our goals? How are we finding ways now to minimise our dysphoria? I often focus with both parents and children on the difference between a want and a need. And this comes back to that great question before, how do you speak with parents about cisgenderism? I really say to parents and to children, having your gender acknowledged and affirmed is a need. It's not a want, it's an absolute need. It's fundamental to your being, to the way you are in the world, to your mental health. And then I might say a need is an iPad. So, up to the parents if you give your child an iPad or not. It's a want, sorry. So you want that. maybe you probably don't need it, but your gender needs to be affirmed. So making that distinction between want and needs is a really good way to be affirming of the child and to encourage the child or the parents to affirm the child because it's a need. And to also say, but there's sometimes when the parents need to make their own decisions, and those are things that are a want. And that could be, a new dress or a particular thing. So it's about making that distinction between things that are very gender specific and are about being affirmed and supported, and things that we don't want to collapse into gender. And again, I can't give you, magical answers for how to work with dysphoria, but it often is a real tightrope because we want to listen to dysphoria, we want to work with it, but we don't always want to let it control everything that's going on in the session, everything about the child's life, because it can become very, very overwhelming for the child. So we want to think about what are some stopgap measures we might put in place, and I've always come up with these on the fly with parents. A young girl who felt very out of place because her cisgender female peers their breasts were growing and hers were not. I just said, how about mum gets you a training bra and you stuff it? And she was like, oh my goodness, I didn't even know I could do that. So it's about that for her, made her feel more part of her group, made her feel not so shut out from that experiences of puberty and change. And she knew that in time to come, hormones in her body would change as well. But this was about really identifying what is the real distress going on for you, and how can we manage that? Some things are harder to manage. That was a fairly easy example, but it is about we've got to know what the actual dysphoria is, what specific challenge is it presenting to the young person, and how can we then creatively find ways to respond to that. When it comes to support, I really say be prepared to be surprised. Sometimes you'll have families, I've had families come to see me, and the first appointment was mum and grandma and an auntie and the child. And grandma was super, super supportive. Then you might have another family where mum or dad are gay or lesbian, and they might be not as supportive. You really can't predict how supportive a family is going to be until you start exploring what do the ecologies, so the networks of support look like. Siblings can be really complex. Siblings can be an absolute fantastic ally, particularly at school. But also siblings, like in any sibling relationship, there can be rivalry. A cisgender sibling might feel they're being left out of the picture or not getting any attention because the trans or non-binary sibling's getting a lot of attention. I've certainly had cases where a sibling of a trans young person intentionally misgendered them to get them back for something. So it's about really acknowledging that there's strengths and challenges with every kind of family member. Often mums get on board to be affirming quicker than dads, but that is not uniform. I've certainly worked with mums who really, really struggle, who really, really feel, I carried this child, I birthed this child, this is what I thought their gender was, and now I'm really struggling to accept that is not their gender. I'm really struggling to let go of often what it is the parents' dreams. I was looking forward to my little girl growing up and having a baby and getting married, because that's what I did, and I really want that for them. And then the child says, I'm not a girl, mum, I'm a boy. And those dreams have to be adjusted. And some parents go, oh, fair call, that was my dream, it's not your dream. But other parents really struggle to let go of that. Close friends can be a really mixed bag again. Some close friends are absolutely affirming of their trans or non-binary peer, and some really struggle. So I often talk with parents and children about thinking about a distinction, and this is not a perfect distinction, but a distinction between things being private and things being secret. So when we treat it as though being trans or non-binary is a secret, that's a really big weight on kids and families. And so that language of secrecy to me is not often productive. Whereas it is private. There's lots of things we would think about that are private family business, and we choose when we might wish to share them. And so it is about working with young people. Is this friend you're thinking of sharing this information with trusted? How can we maybe discern if they're trustable? What is your backup plan if things don't go well? And how are you going to negotiate the situation, whether it's at school or at a social grouping, if things don't go as you planned when you disclose to your friend? So again, I'm not giving you magical answers today to respond to each of these aspects of case formulation. It's more about saying, this is the themes that I see consistently in my work, And this is how we might think about beginning a conversation to try and respond to some of these issues. Something else that's really interesting is that often trans and non-binary people, and not surprisingly, want to connect with other young trans and non-binary people for support, with the presumption, well, you'll get what I'm going through. And sometimes that's true, and sometimes it's not true. We certainly know from the Trans Pathways report that young people who were more invested in being connected and caring for their trans and non-binary friends and being cared for in return reported higher rates of poor mental health and higher rates of self-harm. And I would say that is about both the cost, so burnout, arising from supporting one another in a context of cisgenderism, but it's also about that why would we expect that someone who's trans or non-binary is going to be any more perfect than any other person? So you might connect in with trans and non-binary youth groups, and you're still going to run into other people who you don't get along with, who have a different view of being trans or non-binary, a different view of the world than you. So it's really, I always say to clinicians, yes, if a young person wants to connect with a support group that's run by or for trans and non-binary people, help them do that. It's our job to know what those support groups are in our own areas. But it's also about acknowledging it's not the solution to isolation. It's not going to fix everything. We need a wide range of support systems, and we need to keep checking in. How is that youth group perhaps that you're a part of working for you? Are there things that are challenging? Are you experiencing isolation in that group? Because that is often when things can become very challenging, as a young person thinks, right, I'm going to connect in with other trans and non-binary young people, and when they don't find that space to be supportive, they're really left with the sense of, well, then I don't fit anywhere. So it is about really acknowledging that it can be a great source of support, but also a great source of challenge. So the final part of the gender mnemonic is reinforcement and resistance. And I sort of originally had this as just reinforcement, but as I was writing the book, I realised resistance is a key part of this as well. So reinforcement is about the idea of using our clinical authority to reinforce what young people are saying to their parents, to support young people in their schools, to come from a place of knowing, informed, evidence-based clinical knowledge, so that we can support parents who aren't being accepting. We can find ways to engage the family through our clinical authority so that the child is not left isolated. It can be about reframing the parent's words and emotions so that we shift any sense of blame away from the child and instead look at where are those messages parents might have coming from. And they might be from society, from media, from their own families and parents. So that is about clinical authority. So that's a really simplistic sort of reinforcement, reinforcing the child's right to be themselves and their gender and to be affirmed in their gender. Resistance is about thinking about how do young people resist cisgenderism? How do they speak back? Some young people don't want to speak about being trans to other people. They don't want to be public about that. Other people really do. Everyone's journey is their own journey. There's no right or wrong answer to that. But it is about really identifying moments when children assert their agency and really celebrating that, acknowledging that they are creating change within their family, within their friendship groups, within society. Because I think part of the broader cisgenderist narrative is one that really disempowers trans and non-binary people. It really takes away the capacity, or tries to take away the capacity to make change happen. But we know that trans and non-binary people are affecting change all the time. So it's about acknowledging how young people, and children in particular, do that same work of resisting change. And it can be as simply as creating change in their school, within their families. It doesn't have to be changing the whole world, but it is about making those contributions that make their life a better place. And for some young people, it's making other trans and non-binary people's lives a better place too. So it's about really acknowledging that resistance to cisgenderism, and also, of course, acknowledging our own resistance to cisgenderism and how we need to fight, how we need to sign petitions and write to our MPs and make government submissions to resist ongoing forms of cisgenderism in the clinical sphere, in the public policy sphere, in the legislative sphere. Oh, so that was my presentation for today. I've gone through it a little quicker than I had expected to, but that's because often people have a lot of questions. I ran a similar a training session a month ago, face-to-face, and there was a lot of questions about all of the gender development materials. So I wanted to really factor in time for people to have questions. Perhaps Sally might join us back again now, and we might think about if there's any questions that Sally might have, or any other questions that might come through while Sally's sort of responding to today's webinar.
Yeah, thank you so much, Damien. I found that really intriguing. I deliver lots of training on LGBTI mental health, and to have some other frameworks, I guess, to how we talk about gender is really helpful. And I think for many of us, because we live in a very gendered world, we often don't see gender until often, and for many LGBTI people, we see it because we don't quite fit the narratives. So that was a really helpful presentation to just how is the world constructed around us. And I think it was really interesting that Jane sort of asked, I guess, how do you go about communicating this construct of gender to people who often might not see all of that around us? What is your experience with that? How does that often go?
I think that idea of asking parents about their own gender journey often brings out the most useful clinical material. So, I often say to mums who are maybe struggling, these are often mums who don't wear makeup, they've got short hair, they're in the room wearing pants and boots, and I say, you're a woman, and I know that because you've told me. You don't have a really stereotypical gender presentation. How does that fit with your understanding of your gender? And often women, and it is often women, will talk to me about, when I was growing up, my mum and dad expected this of me, and then I got married and my husband expected this of me, and I've really had to fight against it and say, this is what it means for me to be a woman. And I sort of say, well, so you've got some understanding there of what it's like for someone else to challenge your gender. That's maybe what you're doing here to your child here as well, as doing the same thing. You're really questioning their gender rather than listening to them and their experience of their gender.
Yeah, awesome. Thank you, Damien. Just a question here from Olivia. Do you have any suggestions for minimising burnout in the peer support group environment?
I think it is about, I would encourage young people, step in and step out. So if you step in, and often a lot of the stuff happens online, often online private Facebook groups for trans and non-binary young people. I really encourage young people to know what their boundaries are. So if you're seeing this and that being said and that doesn't align with your values or it directly challenges you, step out of the space rather than feeling compelled to stay in the space and feel shut down or marginalised. So stepping out, I think, is really important for young people to avoid burnout. And also acknowledging that no one can fix everyone else's problems. So it's not the role or responsibility of a young person to stay in an online space or a face-to-face space and fix everyone. And often, maybe that comes from a space of feeling like, no one listened to me, so I want to listen to everyone else. But we can't fix everyone else. So really supporting young people to step out when they're feeling overwhelmed by other people's dysphoria, other people's challenges, other people's distress.
Thank you. And just a question also there from Rachel. Just can you repeat what you called this approach, and have you written any articles on this that we can share with others?
I'm just clicking through my slides. So I call this the gender mnemonic, and so more broadly it's part of a critical developmental approach. I've got a book that's coming out with Power Grade early next year that goes through all of this in 60,000 words of detail. But I know I can certainly send to Sally to send out to people. I have like a 2-page summary that breaks down all the parts of the gender acronym and just what I've talked about today. But that's one way that I can sort of share that information ahead of the book coming out.
That would be really helpful, Damien, because we record these webinars and we make this available on the Alliance website. And we also can, if you're happy for that to be shared, Damien, include that PDF document there as well.
Definitely.
Yeah. I just want to check if there's any other questions from anyone in the audience. While people are still typing, actually, I guess another question I have, Damien, is certainly I notice in our society the expectations we have around people with a male gender versus people with a female gender. How do you see that presenting in your work? I often reflect that we tend to have more flexibility around how people express femininity and less flexibility around how people express masculinity. So do you find how does that emerge in your work?
Could you possibly say that a different way? I'm not quite sure of the question.
I guess what I'm sort of saying is, I guess, as someone who is assigned female at birth and raised as a female gender, often we have more flexibility about how we express our gender. I guess it's easier for girls to be tomboys and to wear shorts and have short hair and run around. But for boys, I often see that there's a lot more constraint about this is how boys are supposed to act and supposed to behave. I think our society has more stricter rules around masculinity and how boys are expected to behave. So do you sort of see, I guess, when you might come across a child or young person who might be transgender or non-binary, do people find it easier to accept a non-binary person who might have a female sex assigned at birth versus male?
Very complicated, but very good question. I think you're right. Everything you're saying is right. I think part of it is does come back to parents' own journey. So there's going to be some parents and maybe a larger group of parents who really do struggle around children assigned male more than they struggle around children assigned female. But also, at the same time, I think it is about that parents will try and, I guess, I'm thinking about that some parents will then try and leap to a new norm. So a child who was assigned female, and they've told me that they're male, or they've told me they're non-binary, or they've told me they're agender. Okay, so now I want the rules for that. So now I'm going to let go that they don't need to follow these female stereotypes. So tell me what the new set of stereotypes are. And I think, recently I've been working with some families where a child is non-binary, and those families are really struggling because they're like, oh, can't they just be, a trans boy? Because then I'd know the rules. I just buy them trucks. Like, it'd be easier for me. So it's often about really helping parents to go, okay, all of this is cisgenderism. All of this is about these boxes that got us into the problem in the first place. So let's listen to what your non-binary child is saying they are and how they experience their gender. And they might be on a spectrum of gender expression, but you need to listen to that rather than trying to go, okay, so I have to let go of the old rules, so just tell me the new rules. That's just repeating the same problem that we have in the first place.
And I think particularly around gender, I think as a society and a culture, we enjoy rules. We like boxes. We like knowing how to do things. And it's a very solid construct in our society and culture. And to unpack it for many people is very uncomfortable because it feels very concrete.
I think some parents also feel like, okay, so if my child is this particular gender that is not the gender I thought they were, so I have to let go of that. Some parents feel that is telling them they have to let go of everything as a parent. How can I parent my child? Can't I discipline them anymore? Can't I have boundaries? Can't I have rules? To me, that really comes back to that need versus want thing. Like, I will often play a bit of a joking game with parents and children in the room. These are things that I'm here to say to your mum and dad, if it's mum and dad, this is non-negotiable. This is about affirming your gender. But I'm also here to say to you, child, that doesn't mean you get carte blanche on all these other things, because your parents are still your parents, and they need to say, look, I acknowledge you're a trans girl, but age 6, any child I have is not going to wear nail polish because that's not my values. That's not, denying your gender as female. It's not being affirming of you. It's just saying, as parents, we're allowed to have our own boundaries around what we think is okay for our children to do. I really name those as moral boundaries, and so parents may reevaluate those moral boundaries. But it is about thinking that affirming a child isn't then saying, well, I can't parent. I have to give my child everything, otherwise I'm not affirming them. There is a difference between affirming someone's gender and everything that sits around that, and then all the rest of the things. Because gender is one part of our whole life. It's not every single thing, therefore, must defer to gender.
Wonderful, thank you. I've not seen any other questions come up as of yet. I guess just another question I have. Do you often see parents and maybe also sometimes children confusing sexuality and gender or conflating those two?
Definitely, and it seems to be something that I see from dads a lot, which is interesting to me, is this idea of, well, my child's 7, and so they've not had a intimate partner or even a romantic crush, so they can't even know who they're attracted to, so then how can they know their gender? So it's not just or as simple as collapsing gender and sex. It's about saying, until you know who you're attracted to, you can't know what your gender is. Well, I say to parents, well, A, that's completely spurious. One hasn't got anything to do with the other. B, we don't say that about cisgender kids. We don't say, well, until you know who you're attracted to, we're going to accept that your cisgender gender is correct. So why would we say that to trans kids? So sometimes, less often I see parents collapsing sexuality and gender, but that's really easy to correct. It's just clarifying the language. It's more this idea of, if you don't know yourself as a sexual being or a being who's attracted to people, how can you know your gender? And that's super problematic on every level. It's problematic because not everyone has sexual attraction. Some people are asexual, some people are aromantic. It's also problematic because it's a really strong argument for not supporting a child. To say, well, we'll just wait till you go through puberty and then you date people and then we'll see what your gender really is. It's actually a really powerful way of holding a child back from being there.
Absolutely. Yeah. Question here from Natasha. I heard someone on Triple J Radio saying that they have come out to their nurse or doctor as being trans every time they go into an appointment. Would you say that in hospital settings there is a need for more education about this, or changing the laws about having genders in writing, or both? Thanks for your awesome information.
That is an awesome question, Natasha. It is, I think it's all of these things. I think it is about how do medical systems cope with information? How does it record information? And then how does it record changes in information? So certainly, I've had parents go to emergency wards with children and go ahead and prime the emergency room staff. Our child is trans, the medical records might say this, please do not use that gender, please use this gender. I think, until there's better ways of documenting gender and then making sure everyone's apprised of that, that kind of thing is going to continue to happen. But I think it is also about then there is a transfer of responsibility. So that mother was trying to transfer that responsibility to the medical staff and say, right, you need to now make sure everyone who comes into contact with my child uses the correct pronouns. And it didn't always happen because that transfer of responsibility wasn't taken up. Staff didn't acknowledge they needed to be on board with this child's gender to give them the best medical service they could, and therefore they needed to make sure other people who were treating this child were engaged with the child's gender. So it is about, there are things that could be changed in terms of record keeping that would make this easier so that people don't have to disclose that they're trans every time, but also when people are disclosing, that information needs to be treated sensitively but also shared with appropriate clinical staff so that people aren't having to keep coming out all the time.
Wonderful. Thank you very much. Unfortunately, we've run out of time for today's webinar, but I really would like to extend my thanks to you, Damien, for sharing your knowledge and wisdom. Certainly, I know I learnt a lot more today and really will help us, I think, at the Alliance, how we talk about gender and trans and non-binary experiences. So thank you very much. Just to remind everyone that this is being recorded and will be made available up on the Alliance website, hopefully within the week, and I'll also share the PowerPoint slides along with the article that Damien has mentioned there. Actually, Damien, do you have contact details that people can get in contact with you if they wish to ask additional questions?
Yeah, I'm at Flinders, so my email address is damien.riggs@flinders.edu.au, but I'll put that on the PDF of the gender mnemonic as well.
Awesome. Lovely. Thank you very much. Thanks again, Damien. Thank you, everyone, for participating. And I look forward to seeing you all for future webinars. So thank you very much.
Thanks, Kelly. Bye, everyone.